I've struggled with this my whole life. It just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz. It's actually Wednesday, January 3rd. This young man, he's from West Virginia. He drove in, right?
Drove into, yeah.
Drove in for my gynecomastia surgery, which is actually tomorrow morning at 7:30. But he's coming in to meet me because we Skyped or FaceTimed, so we never really met face to face. And so I can actually look at him outside of the computer and see what he's got. So he's got gynecomastia. He's in his young 20s. He's fit, he's skinny, but he's got gynecomastia. Left side is a little bit bigger than the right side. If you lift up your arms, it's kind of all this stuff right there. There's a tail to it, there's a head to it. Make an incision under local anesthesia where the water meets the beach, and obviously on both sides, get this gland out to absolute perfection. He's young, his skin is gonna bounce back and adhere back down. No inverted nipple, never a recurrence, I guarantee my result. And we're gonna make him look amazing. So this is the first time we're actually meeting. We're going to have him do his consent form now, go over everything, the risks, the benefits, the alternatives, the complications of the surgery, and start bright and early tomorrow morning. It's supposed to snow tomorrow, so we'll see how that looks. So do you have any questions that you have, or mom's here?
Yeah, when you go in, do you go just like go in sub-Q?
Well, I go in where the water meets the beach here, so the scar's hidden, and I have a certain technique I use. So I go down in there and I see the gland. Gland is white, fat is yellow. I want to preserve his fat, but I want to remove the fat at the same time. So what I do when I go down there, I can see that white gland kind of, peeking at me. And so I skeletonize a little bit of fat around there, and I hug the gland and get under the gland, where the gland is. There's muscle, pectoralis muscle, gland, and then skin. So I got to get under that. And with my local anesthesia, it actually hydrodissects this, so the gland kind of floats in there. So I'm in that right spot. I can get my finger and I can kind of finger fracture the gland away from the muscle, so I do not harm the muscle, I do not gouge the muscle, I do not cause bleeding of the muscle is pristine. So I get under it, if you can envision me do that with my finger, and then I separate it from underneath, and then the side, and then I take my scalpel. If you look at my videos, you'll see it, and I actually shave the gland off because it's stuck underneath the nipple. And I shave it, leave a little bit of gland underneath there, just so that it has some support. And I just take it out like a little scallop.
So it comes out in one fell swoop, or you have
one fell swoop.
Yeah, or
one piece.
Usually, yeah.
No, I'm pretty good at what I do. And then when it's out, especially on this side, I don't know, maybe he's got more fat here or gland. Then once it's out, then I have these retractors, and I'll take a little fat here, take a little fat here, take a little fat here, take a little fat here. I'll measure with my fingers on both sides, make sure that's perfect, make sure that it's perfect here, and irrigate it, stop any bleeding with my cautery. No drains are going to be needed with him.
Okay.
And then close him up. Now when I close him up, I have my certain technique where I take this muscle and I just kind of jack it up so it's lifted. I want him to have more of an athletic, lifted chest rather than a droopy, especially on this side. See, it's droopy.
Yeah.
I want the muscle and everything lifted, so he's got more volume up on top and less volume down the bottom.
How do you actually lift the muscle? How does that work?
With stitches. I stitch it high up.
To the skin.
Well, it's not to the skin, because that would pucker it. To kind of the support of the skin.
Okay.
Underneath, you mean?
Inside, yeah. Certain technique.
Yeah. Okay.
Yeah.
Again, look at my videos. It's all, I
saw that
thousands. I got thousands.
Yeah, several.
Yeah.
And so the what's that saline that you're injecting in the videos? Is that?
That's saline with lidocaine and epinephrine and a little bicarb.
And then you said that kind of helps to float the glands.
The glands.
Is that
like the movie It?
Me, you'll float too. You'll float too.
Yeah.
Good. Okay, so all of this is under local. He'll feel no pain, right?
Feel no pain.
Alrighty. So
And then I guess my biggest
You've
concern
caused them
is,
more psychological damage than what I will.
Yes, I didn't want him to go through this. I said anybody who loves you is going to love you just like
Exactly right. Exactly right. But it bothers
that.
him.
It bothers him.
I did Garrison's about 8 months ago, and it bothered him.
I guess it
and
bothered
I think
you.
you were more like this side.
Yeah.
You were
Actually, I don't know. Mine were just puffy.
yeah.
Like really pointy and puffy.
Yeah, and he's happy as a pig and you know what right now. And the scars, I'll show you. You can show you the
okay,
scars.
yeah, that's my biggest
Absolutely.
concern is really the scarring. So what can I do to kind of,
It's gonna heal by itself.
Okay. So
Yeah, I mean you can do
just continue
scar
with
cream,
the
and-
supplements and
yeah, it's good. It's gonna heal great.
I think he's afraid of having like a scar on the nipple, you said.
Yeah.
Right?
What's under the nipple?
Or
Yeah.
a retracted
Under?
nipple.
No, you won't have. No,
No
I don't cause that.
retractions.
Nope.
'Cause that will-
Nopey.
all
It's
right.
gonna look great. Yeah, but you're gonna look amazing. So yeah, so that's what I do. I give him a lifted, athletic, perfect, never recurrence. I guarantee my work. It's gonna look amazing. And that's what we're gonna do. So we're gonna have you sign the consents right now, get everything done with. I've explained to you the procedure, the logo, numbing. I'll tell you the risks, the benefits, alternatives, complications, everything. Wash your hands if you're gonna help them, so you don't get any infection. Stay away from people who are sick. You know, anybody coughing, sneezing, vomiting, stay away from them. And you're gonna look amazing.
Okay.
Great.
Okay,
That's
good.
what he wants.
Can't wait.